Hi, my name's Dr. Paul Ouellette, otherwise known as Dr. O.
Our family of dental specialists welcome you to the Dental Specialists YouTube channel, your online media source for dental information.
Well, I started coming to work with my father when I was about 10 years old, and basically would hang out in the back of the office, sterilize instruments, make impressions. By the time I was about 14 years old, I was comfortable enough to start working a little bit with patients and just feeling my way around the office and kind of making it home for myself in a way. I really enjoyed it, I always have, and realized that the family business was where I really wanted to be. This office is my home. This is where I belong, and working with my father has been a wonderful experience, and it's great that he and I can now discuss cases and chit-chat back and forth on how we would treat certain aspects of a case. And working with our patients is great. I like that they feel like it's a homely environment, and I think to me that's one of the best parts of this career.
Always as a child, I hung out with my dad in his office. I used to help with sterilization. I'd help with all facets involving his practice. I especially enjoyed seeing him just work with kids. You know, it's a great environment to work in. Every patient leaves here, they have a beautiful smile, and it's really a great thing. It's a blessed profession. To be in this profession, you actually change people's lives. I went to dental school in San Francisco, so it definitely wasn't a bad place to go to school. It was definitely a beautiful city. Just really a lot of life experiences. Definitely found the rewarding side of dentistry in San Francisco. We treated a lot of the indigent people, people with complex health histories and such. So definitely got to see a large, diverse patient group, and it was really rewarding.
My mom was actually a patient of Dr. Ouellette's as well. Not to date Dr. Ouellette, but she was a patient first. And she had a really good experience. So when it was my turn, of course, obviously that was our first decision. And I spent a couple years in treatment with him, and it just always seemed like a fun place to work, like something that would be suited for me. I like the interaction with the patients, and I've been doing it for about 12 years now, so I just kind of feel like it's the one thing in this world that I know something about. And I love helping my patients make decisions about their treatment.
Well, I think our practice and our family is centered around patient care, and also the patient experience. We want them to have a positive experience when they come to our office. And if you just look at our office and the atmosphere that we bring, the people that work for us, everybody loves to be here and loves to be treated by our family. And so that's what we draw in the community, is that need to be treated like family in a dental or orthodontic practice.
I absolutely plan on being here for as long as they'll have me. I have to say, when I first came here, I was just so thrilled. I couldn't even believe, I mean, not only, like I mentioned before, the technology, it just makes this place so much more exciting. Of course, the beautiful view, which is nice and tranquil for the patients as well, but the entire atmosphere is wonderful here.
Well, the first thing every person notices when they are introduced to anyone is their smile. So you don't ever want to have that insecurity when introducing yourself. You want to have a great smile, and that was something I wanted to look forward to in my future with my career, my job, and I knew even back when I was 13 that I wanted to be in dental. So it kind of worked out perfect for me. I knew that this is what I wanted to do, and I didn't want to have to introduce myself and be insecure about my smile.
Here, it's just really rewarding to work for people who really are treating people. You know, they're thinking about the patient and their best interests in mind. And, you know, it's never really been about the money here. It's been about the proper care for the patient, and that is really nice.
Every person, every family that comes in here, they're aware of who works on them. And we have several offices, and each office, they see the same faces. It's not they come to one office and then they come and visit this one and it's a whole other group of people. We get to grow with these patients and see them from point A to point B and how they change in the year, whatever it is, and it's nice. I got my braces here 9 years ago, and now I work here. What else can you ask for?
And that's what we want. We want every patient to have an experience that they'll remember for a lifetime. And most of the time, you know, when a kid comes into ortho, we want it to be fun. We don't want it to feel like a dental office where they're getting, you know, a shot or anything like that. We want it to be a very calm environment for the patient. And if you look at our views of the river and, you know, the people that have been working for us, you know, you see that this is a practice that's oriented around patient care and about the patient having a great experience.
what I really want to do is follow in his footsteps and continue on that legacy of technology and advancing this wonderful profession.